Okay, I'm going to go ahead and do a cardiac and peripheral vascular assessment. So initially I'm going to inspect my patient's abdominal and chest area, thorax region, to make sure that there are no areas of ecchymosis, no reddened erythema areas. The chest is symmetrical on either side. It seems that there is even hair distribution on my patient's chest and arms. Any complaints of heart problems, palpitations, chest pain?
No.
No? Okay. I'm going to go ahead and I'm going to palpate my patient's thorax region to make sure that there are no lumps or bumps. I'm sorry if my hands are cold. Any pain or tenderness when I press here?
No.
No. I'm going to look at my patient's fingernails to make sure that there isn't any clubbing. So I'm looking to make sure that it is at a flattened angle, that there isn't any clubbing noted. I'm looking at my patient's capillary refill, making sure it's less than 3 seconds and comparing with the opposite hand. And next I'm going to auscultate my patient's cardiac landmarks. I'm going to be sure that I auscultate using my diaphragm and my bell to make sure that there are no thrills or murmurs or bruits noted when I auscultate. And you can just breathe normal. So I'm going to start at my aortic landmark, which is second intercostal space, right of the sternal border. And I'm listening for that lambda. I'm going to move across the sternal border to my pulmonic valve, which is second intercostal space, left of the sternal border. I'm going to move down to Erb's point, which is third to fourth intercostal space, left of the sternal border. Moving down to my tricuspid region, same left of the sternal border, fourth to fifth intercostal space. And if you can go ahead and sit straight up for me. Moving down to the mitral region, which is fourth to fifth intercostal space, mid-clavicular line. I'm going to flip it around to my bell. I'm going to listen to the same 5 cardiac landmarks, starting with my aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm making sure that I don't hear any whooshing or swooshing. I'm also looking at my patient's apical impulse, which is the fifth intercostal space, mid-clavicular line, to be sure. Sometimes you may see in about half of your patients, you may see a small impulse or pulsation that is normal. That would be the only location that you would find a pulsation to be normal. You don't see it on my patient here, but you may see that in your patient. I'm going to assess my patient's pulses. I'm going to start at the carotid, making sure that I palpate one carotid at a time. I'm gonna move to my radial pulse. And I'm assessing them at the same time to make sure that they are equal bilaterally. I can feel that his pulse is +2, regular, and equal bilaterally. I'm gonna move up to my brachial. And they are +2, regular, equal bilaterally. And if you could just go ahead and lay down, and you can keep your knees flexed up just a little bit. You can lay them down a little bit more. I'm looking for my popliteal. You want to make sure that your knees are slightly flexed. And they are +2, regular, equal bilaterally. I'm going to move down to my posterior tibial, which is on the medial aspect. And they are +2, regular, equal bilaterally. And then dorsalis pedal or pedis. And they are +2, regular, equal bilaterally. While I am here, I'm also going to assess my patient's skin integrity to make sure that there are no open areas. I also will be assessing if my patient has any edema. If my patient did have edema, I would grade it on a scale of +1 to +4. However, my patient does not have any edema noted.